Hi, so today I'm going to be going over autistic spectrum disorder, the characteristics that you might find with someone that has autistic spectrum disorder, also known as ASD. You might want to be familiar with some early signs of ASD. So, some of the earliest signs of ASD is a lack of social warm gaze, social smiles, vocalizations, response to name, they avoid eye contact, and the lack of social interest. So, you will see them kind of withdraw from any kind of social activity with their caregiver. And then you will see also some repetitive behaviors. They won't point or look at the similar object as their caregivers. They prefer not to be held, but not always. But those are some behaviors that you may see. They have difficulty in relating to others. They have delayed language development. This one is big. If you see someone that has delayed language development, that is a definite sign, but not always, because sometimes it's just speech and language delay, and that's it. So don't automatically think if there is a language delay that that's what it is, because that is not true. So those are some of the earliest signs that you might see, but don't go around diagnosing everyone just because they have a language delay. It may just be a language delay. So some of the behaviors that you may see is the obsession with specific content. Like they might be obsessed with Spider-Man and all they could talk about is Spider-Man. They have repetitive behaviors, and a lot of them have sensory processing dysfunction. They have lack of social interaction and play. So you might see them playing with the same items, but they won't interact with the person they're playing next to. And they have an inability to communicate, limited language development. Some of them may be nonverbal, no language at all, but some of them may have repeated words, single words, and a lot of the time you may see tantruming. And also another one that you may see typically is that they are very specific on what they'll eat. Their diet is very restricted. They have only certain foods that they like, and that's all they'll eat. So some of the characteristics that you might find with cognition is their scores are found to be lower overall, but the low scores are not predictive of later development. So don't automatically think if they have low scores, it's going to stay low, because sometimes they just don't test well. What they have seen with the IQ is that with early intervention, that their IQ actually went up. So that is a truer picture of what their IQ is. Although their cognitive ability is generally lower, it can vary from low to superior IQ. So it could be a range all the way from the lowest level to the highest level. Now for neurological characteristics. With the use of MRI machines, we've been able to see far more than we've ever been able to see before. Many areas of the brain is enlarged, and there's far more white matter in those areas. We've also been able to see that there's a decreased use of the frontal areas and an increased reliance on the right hemisphere. Sensory processing dysfunction is another characteristic that we find in ASD. It is critical that we learn through our senses. So if you have dysfunction, it's going to be really hard to learn. Up to 90% of the people with ASD have sensory processing dysfunction. Over 96% have hyper or hyposensitivities or mixed in multiple domains. Many of them have an unstable sensory load. They don't know how to manage the sensory input that they're getting. Communication is another characteristic that we see in ASD. They are less likely to initiate communication than their peers. Their communication consists of irrelevant details, inappropriate topic shifts, preoccupation with specific topics. So you will notice those things within how they communicate with others. And another area of concern is language. Language scores were found to be lower overall with children with ASD. They tend to have idiosyncratic language, unusual prosody, means they sound robotic, and echolalia are all typical. Echolalia is where they repeat what you say. Another thing they see is language regression, or the lack of progression. They have impaired expressive and receptive language. Another characteristic you might find with children with ASD is they lack in social interaction. They tend to keep to themselves. They have a lack of eye contact. They don't respond to their name. They're not interested in anything social. In fact, they actually withdraw from social engagement. And they mostly play by themselves. They have selective attention. They can parallel play, but they have difficulty playing with others. That parallel play is where they play next to people but don't actually interact. But the good news is early intervention. Early intervention is key with children who have autism. So it's really important that we pay attention and are aware of early signs of autism. But remember, just because they have a language delay does not mean that they have autism. It could just be a language delay, so keep that in mind as you are coming across people that you see early signs. Some helpful supports, I want to leave you with this. They are great with visual schedules. So if you are working with someone who has ASD, visual schedules are amazing. Also, sensory tools to help them with their sensory dysfunction. There are so many benefits of augmentative and alternative communication strategies, such as using the picture exchange communication system or some sort of auditory communication device. So it is really important that you get these things put into place early on. Early intervention is the way to go. And also I have attached references where I got a lot of my information from.